As a naturopathic doctor for almost 20 years, I have helped many people get through fevers and acute infections. Now, I don't know much about COVID-19, but I do understand the natural healing process, and I have seen people through some really intense infections, sometimes from life-threatening things where there really were no good mainstream medical options. And this video is about supporting the natural healing process when you are in the midst of a fever. This is not a video about preventing COVID-19 or about taking a bunch of supplements. This is how you manage your fever and your acute illness from a naturopathic perspective, and to do this in such a way without incurring any damage or destruction to your lungs or other internal organs. Now, I have to make it clear right from the start here that I am not suggesting that you forego any useful conventional medical treatment. And in the description of this video, I'm going to have a link to the CDC's website, which gives some basic advice about how to handle the situation. And one of the things that's recommended by the CDC is that if you think you have COVID-19 infection, that you should contact a medical doctor. You know, it not only helps public health track this disease, but it also can set things up so that you can get appropriate medical care if it should come down to that level. And it's good to have that set up in advance in case, things don't go well and you end up getting really, really sick from it. So when I talk about naturopathic medicine for the treatment of fevers, I just want to say there's a really long tradition of this. And a lot of the stuff is things you may have heard before. One of the old authors called this granny medicine. It's wisdom that your grandmother may have known. It's really ancient wisdom. And what you want to do is support the natural healing process when you are sick. And there's this ancient idea that the fever is actually going to make you healthier, that this is a healing process. It's called a healing crisis. And this idea is ancient. Hippocrates is quoted as saying, "Give me the power to create a fever, and I shall cure any disease." So the point is not to try to stop the fever or suppress it with some medicines. You just let your body do what it's trying to do naturally. And your immune system functions more powerfully when you have a fever. So most of the time, you just want to let it do its thing. Now, there is a place for suppressing fevers sometimes when they get out of control. And sometimes people just want to take some suppressive medication just to get through it, just so they feel better temporarily. And I understand it if you're at that point. But what I'm going to be describing here is the natural way to support the healing process. So if you're just starting to feel sick, the first thing you need to do is go home and get into bed. Your body needs rest. And you need to be sheltered from the cold. And if you're out in the cold, you need to wear a hat. And do so until you can get home and get into bed and let your body rest and do what it's trying to do. The next thing I want to say about it is do not eat if you have a fever. So the general rule of thumb in naturopathic medicine is if the body temperature goes above 100 degrees Fahrenheit, you have nothing but liquids, meaning water or herbal tea. And if it's lower than 100, you can still eat. So of course you eat if you have to, but that's the general rule of thumb, and it makes a big difference. But what if you feel like you're coming down with something and you feel a little feverish and you check your temperature and it's actually not elevated? What if it's actually low, but your skin feels hot and you feel like you have a fever? That's called a suppressed fever. And what you need to do is warm your body up so that you will have a higher body temperature. So a hot bath is really helpful at this point, or a hot shower, or if nothing else, just drinking some hot liquid and getting under the blankets. Ideally, get a sweat going, which is something else I wanted to talk about. Sweating is really, really helpful. It's part of the discharging process that your body is doing when you have a fever. So if you're feeling achy and feverish and uncomfortable, warm your body up, get a sweat going. Okay, so those are the basics of it. And then there's something a little bit more advanced that I want to talk about. There is an age-old method to help people discharge and dissipate acute viral infections, and it has to do with activating certain reflexes of the body. Here's what you do. Next time you get out of bed, grab a small towel, such as a hand towel or a washcloth, run it under cold water, then roll it up, wring it out as much as you can so it's just damp, grab a dry towel, and go back to bed, and just leave these things next to you. Once you are warmed up in bed, I want you to unroll that cold, wet, or damp towel and 1 layer thick. I want you to lay it across the bare skin of your chest and abdomen. Then put the dry towel over the top of you, and then pull the blankets over you. Okay, it can feel a little bit shocking at first, but trust me, once it's going, it'll start to feel good. This is going to pull the inflammation out of the lungs and internal organs, and it will help you feel better. Basically, what you're doing is you're just letting your body heat up that wet towel, and you can remove it after 10 minutes if you want, and then repeat it a couple of times if you can. This really, really helps. Generally, after a minute or two when the towel has been on the chest, a breathing will deepen, a person will relax. It's better than any cold or flu remedy advertised, and it's not only just helping you feel better, it will hopefully keep the infection from going into the lung. So that's really what the battle is about here, is keeping the infection on the surface, keeping your body discharging, letting your body do its natural thing, which is to keep the infection out of the internal organs. And yes, of course, speak to your medical doctor if you feel like things are going badly, if you need some further medical support. But I tell you, these simple home practices will really, really make a big difference. So I hope that was clear, and thanks for watching.